We've got a few people joining in. Hello, everybody who's joining. Thank you for taking part tonight. We're just going to wait a few minutes while everyone kind of filters in. It normally takes a couple of minutes for everyone to get settled. So do sit back and enjoy while we're waiting.
It's usually best to wait a few extra minutes. Some people might have difficulty logging in, mightn't they?
Yeah, exactly. And I think sometimes, it's the modern world, isn't it? Zoom always requires a little bit of an update, or there's always something that'll pop up. But a very warm welcome to everyone who's joining us. I should just say as well that obviously to everyone who's joining us tonight, obviously you can't join on camera, but you can, if you've got any questions or anything as the talk progresses, just pop it in the chat box at the bottom and we'll do a short Q&A at the end of the session. And hopefully everyone should be able to see the lovely cover of your book. How long has it been out now?
It came out about a year ago.
It's about a year. Because it's been a good few months now since you've done your live talk for us, wasn't it?
Yeah, that's right. Yeah, I think it was November. Was it November I gave a talk?
Yeah, it must be. Yeah.
Yeah, I've just written a paper on Wilkie Collins, actually, his medical history, because it's his bicentenary of his birth next year. So
yeah.
Yes, he was. He had quite a florid medical history as well.
Yeah, I mean, I can imagine it's always always quite fascinating to see what Wilkie's medical history would reflect. I think we can probably sort of start. I think there probably will be a few latecomers joining, but we can start all the same. So a very warm welcome to everyone who's joining us from wherever you are. I'm sure we normally get people from right across the world, and it's sort of a real pleasure to have you join us tonight. We're thrilled to talk about Bleak Health, the medical history of Charles Dickens and his family. You can see the book cover there by Dr. Nicholas Cambridge. It's a fascinating read. I would thoroughly recommend anyone who's interested in Dickens's health, or actually just in Dickens as a person. I think what I found reading it was just this, it humanized him in such a wonderful way. And I thought it was a really lovely read. But Dr. Nicholas Cambridge is here to tell us all about it. Dr. Nicholas has been, he was a medical professional for a number of years. In fact, your original job, wasn't it, was as a family doctor for many years before joining the reams of academia, as you have done more recently. And this book, Bleak Health, came out about a year ago. It is a fascinating read on not just the health of Dickens, but the health of his family, and also the kind of contemporary medical practices. So without further ado, I will pass over to the very illustrious Dr. Nicholas Cambridge.
Thank you very much, Jordan, for your kind words. As Jordan said, that my talk tonight is Bleak Health, the medical history of Charles Dickens and his family. On the 9th of June, 1870, Dickens died of apoplexy at Gad's Hill at the age of 58. Apoplexy, of course, today we would call it a stroke. The British Medical Journal said, "What a gain it would have been to physic if one so keen to observe and facile to describe had devoted his powers to the medical art." However, others would argue that if Dickens had been a doctor, he would not have had the great impact on society that he had as one of the great authors of all time. Now, we know that Dickens had a large library. You can see the photograph on the right with his number of books. And certainly he had a lot of books on medicine, psychiatry, mesmerism, temperance and alcohol, prisons, pauperism, water supplies, graveyards and burials, infectious disease, and dictionaries of medicine and surgery. He knew many doctors. Here we can see a few. Thomas Southwood Smith. Dickens went with Thomas Southwood Smith to the factories in the East End to see the atrocious conditions that women and children were working. Sir Thomas Watson and Sir Henry Thompson, Dickens saw them when he was ill later in life. Professor John Elliotson, the mesmerist, Dickens became a close friend of him. And then finally, Dr. James Wilson, who worked at Malvern and where Dickens's wife, Catherine, went for the water cure. When he went on holiday, he took with him his medicine chest. It contained laudanum or opium to relieve pain, ether to treat colic and spasm, sal volatile, smelling salts, Dr. Brinton's pills, which contained iron, quinine, and digitalis, Dover's powders to treat fever, and calomel, blue pills, and rhubarb to treat constipation. Now, Dickens, on his first voyage to America in 1842, the captain became ill, and Dickens established a club called the United Vagabonds, to the huge amusement of the passengers. With the help of Dickens's medicine chest, the captain recovered. Dickens noted that we had a few more sick men after that, and I went round the wards every day in a great state, accompanied by 2 vagabonds, habited by Ben Allen and Bob Sawyer, bearing enormous rolls of plaster and a huge pair of scissors. Now, we know that Charles Dickens wrote 15 novels. The only one he didn't finish was The Mystery of Edwin Drood. Now, Dickens created more than 2,000 characters in his novels, and 50 were engaged in medicine. The majority were surgeons. However, he referred to them mostly as snobs, humbugs, and money grabbers, although some were good doctors. So my question to you is, why was Dickens so critical of the medical profession? Well, I think the reason is that the General Medical Council wasn't founded until 1858 to regulate the medical profession and establish a register of qualified practitioners. And of course, by 1858, Dickens had already written 11 of his novels. Now, during Dickens' life, infectious disease was very, very common. People suffer with consumption or tuberculosis, smallpox, scarlet fever, whooping cough, cholera, measles, the common cold, and influenza. Now, what was causing disease? Well, the popular theory was the miasma theory, and people believed that a poisonous vapor of suspended particles of decaying matter caused disease. And certainly Dickens, Florence Nightingale, and Edwin Chadwick were keen miasmatists. And of course, then during the cholera epidemic, John Snow put forward water propagation as a cause of spreading disease. But finally, the germ theory came out, which showed that disease was caused by microorganisms. Now, tuberculosis or consumption was very rife during this time, and the British Medical Journal had an article printed on the 3rd of January, 1857, and it said 10% of people will die of tuberculosis, which this is obviously a very worrying statistic if you think about it. I mean, a population of, say, 60 million, you're talking about 6 million people dying of tuberculosis. And 3 of Dickens's siblings actually died of consumption: Alfred, Augustus, and Francis. Here we can see a lovely drawing of Dickens's sister, Fanny Dickens, who died of tuberculosis. And here we have a letter that Dickens wrote to his wife, Catherine, about Francis when she was dying. No words can express the terrible aspect of suffering and suffocation, the appalling noise in her throat, and the agonized look around, which lasted, I should think, a quarter of an hour. From that, she sunk into a kind of lethargy. Sleep seems quite gone until the time arrives for waking no more. Smallpox, of course, was also very rife at this time. In fact, Dickens's sister Harriet died at the age of 9 of smallpox when the family were living at 16 Bayham Street, Camden, in London. Many years later, in 1853, was the Compulsory Vaccination Act, when all children under the age of 4 months had to have smallpox vaccination. There were many parents who refused to have their children vaccinated. They would appear in front of the magistrate and would have been fined. Scarlet fever is a bacterial streptococcal throat infection, and Dickens' future wife, Catherine, her mother, suffered with scarlet fever. It's possible that Mary Hogarth, Catherine's sister, suffered with it, and certainly Dickens's son, Charlie, suffered with scarlet fever. For some people, rheumatic fever develops 1 to 5 weeks after contracting scarlet fever. And one of the complications is that it causes damage to the heart. In 1835, Catherine Hogarth, this Dickens' future wife, and her mother had scarlet fever, and Dickens wrote, "I send Fred with some blackcurrant jam, which you will find an efficacious and at the same time agreeable medicine for your throat. I've also desired him to take some chloride of lime from town. The good it will do in purifying the atmosphere of your room will more than counterbalance your dislike of its smell." So the two sentences here. The first sentence, obviously he's suggesting that blackcurrant jam will soothe the throat, but the second sentence is more important. It shows that Dickens is a miasmatist because he's talking about the chloride of lime purifying the atmosphere. Now, Mary Hogarth was Catherine's sister, lived with Dickens and Catherine in Doughty Street. And sadly, they came back after the theatre one evening, and Mary died, and Dickens wrote a letter. "We lost no time in procuring medical assistance or employing every remedy that skill and anxiety could suggest. The dear girl, however, sank beneath the attack. The medical men are of the opinion that her heart had been diseased for a great length of time. Her general state of health and the awful suddenness of her death induced me to think they are right." So certainly it is possible that Mary suffered with heart disease, probably as a result of contracting scarlet fever. However, another person has suggested that perhaps she died of a subarachnoid hemorrhage. It's worth remembering that Mary died 14 hours after collapsing in her bedroom. And the subarachnoid hemorrhage could have been due to a cerebral aneurysm, as you can see on this drawing here. And people get these, what they call berry aneurysms, and on occasions they burst, bleed, and subsequently the patient dies. Now, Charles Culliford Boz, or Charlie Dickens, was Dickens's son, and when he was 10, at a pupil at King's College School, he suffered with scarlet fever, and it took him quite a few months to recover. Dickens's children also suffered with whooping cough in 1847, and Dickens wrote, "Our children have all got whooping cough, and the change is recommended for them. They never cry, but go into the corners to be convulsed and come out cheerful." Now, the Tootine cholera disaster took place in 1849. It was a privately operated residential school run by a Mr. Bartholomew Peter Druitt. There were 1,400 pauper children, and out of them, 180 died of cholera. They were kept in very poor conditions, 3 to 4 in a bed, and had a very poor diet. Now, Mr. Druitt appeared in front of the coroner, Thomas Wackley, who also was editor of the Lancet Medical Journal. And at the coroner's inquest, Mr. Druitt was found guilty. However, when he appeared in a criminal trial, the judge threw the case out and he was found not guilty. So you can imagine Dickens was absolutely furious at this result, and wrote no fewer than 4 separate critical articles in the Examiner: Paradise at Tooting, the Tooting Farm, a recorder's charge, and the verdict for Druitt. In fact, Dickens's daughter, Mary, she caught cholera when the family was on holiday in Boulogne. And she was treated, which was quite interesting. The old remedy was a pill of calomel, mercurius chloride, and opium. Well, of course, calomel was used to cause quite severe diarrhea. And then the later use of laudanum and ether. So certainly the opium would have helped to ease the pain, but calomel would have made the diarrhea worse. And then laudanum certainly would have helped the pain, and ether would have helped the spasm. Now, measles was regarded as a much dreaded disease, which entailed more evils on the health of childhood than any other. And Dickens's son, Charlie, had measles when he was living at Dickens Museum, 48 Doughty Street. And Dickens wrote, "Our boy took measles last Saturday to celebrate his birthday and has been ill ever since. He's got 'em very mild," in nursery phrase. "So I'm not sorry, for it is as it will now be quickly over." I now want to talk to you about Dickens, his lifestyle, and medicine. Now, Dickens said, "I have faith in hydrotherapy." What he meant by this was that he took a daily shower bath, either when he was at home or when he was on holiday. He drank cold water morning and night, and he was a very good swimmer. He used to go swimming in the Thames, Broadstairs, Folkestone, Italy, and Boulogne. He also used to enjoy having a Turkish bath whenever he had the opportunity. He also took Catherine, his wife, up to have the Malvern water cure in 1851. He also was a very keen walker. He said, "Walk and be happy, walk and be healthy." He was also a strong advocate of fresh air. And in a letter he wrote on the 10th of February, 1851, he wrote, "London is a vile place. See that grey, heavy canopy lowering over the housetops." Now, of course, London at this time suffered with smogs or pea supers, and he wrote, "Smoke was the London ivy which wreathed itself around every building and clung to every dwelling." Now, what's interesting in this slide, you can see the link boys helping people across the streets, but there's on the bottom right-hand corner, you could see a link boy escorting a man and his wife, but on the right-hand side where the yellow arrow is, his friend is acting as a pickpocket and taking something out of the gentleman's coat. Now, Dickens was very interested in fringe medicine. One of his close friends was John Elliotson, who practiced mesmerism. Now, John Elliotson, from 1831 to 38, was professor of medicine at University College London. And also from 1833 to 35, he became the 14th president of the Royal Medical and Chirurgical Society, which today is called the Royal Society of Medicine in Wimpole Street. Now, what's interesting is that Elliotson had two Okie girls in the hospital, and from being very meek and mild girls, he used to take them to the lecture theatre and invite gentry and people of substance, and he would mesmerise them, and then they would become very familiar, sitting on the gentleman's laps and stroking their hair and touching their legs. Anyway, the final straw came when one of the girls went round the wards one evening, pointing to the various beds, saying, "That patient will live, that patient will die." And the consultants or the specialists at the hospital were absolutely furious, and Elliotson was asked to leave. Now, here we can see an anonymous anti-Elliotson pamphlet, which says, "A full discovery of the strange practices of Dr. Elliotson on the bodies of his female patients. at his house in Conduit Street, Hanover Square, with all the secret experiments he makes upon them, and the curious postures they are put into while sitting or standing, when awake or asleep. The whole is seen by an eyewitness and now fully divulged. Now, Dickens also decided to practice mesmerism, and he mesmerized Catherine when they went to America in 1842. And then when Dickens was on holiday in Bonchurch, his friend John Leach was with him on holiday as well. And Leach got hit by a wave when they were swimming, suffered with concussion. And Leach's wife called on Dickens one evening and said that Leach was very delirious, unable to sleep. And so Dickens went along and mesmerized John Leach, and Leach was able to get a decent night's sleep. Now, phrenology was a pseudoscience linking the areas on the skull to a person's personality and character. Now, you can see on the left a phrenology bust, very popular. I've got one of those in my study. And here on the right, you can see a slide. Now, I don't know what's going on here, but it's possible that the gentleman sitting down is saying to the phrenologist, do you think my son has got all the qualities to be able to get into Eton and possibly become a prime minister? I don't know, but I mean, that is one of the interpretations I've thought of. Now, I now want to talk to you about Dickens's family medical history. Now, Dickens's father, John Dickens, died at the age of 65. And one of Dickens's letters, he said he walked into his father's room and it was like a slaughterhouse of blood. And what happened was that his father suffered with a ruptured urethral stricture and Fournier's gangrene. And the various doctors came to see him and had to operate on him. And that's the reason there were lots of blood. And in fact, Sir Benjamin Brodie was the sergeant surgeon to Queen Victoria. But unfortunately, they were unable to save his father's life. And what's very interesting is that the person who saw him at the beginning was Robert Wade, who wrote this book, Stricture of the Urethra, its complications and effects, with practical observations on its causes, symptoms, and treatment. And one of the chapters in this book mentions about ruptured urethral strictures, and there is a case history of Mr. J.D., which fits in with Mr. John Dickens, and the history and the timeline all fits in with John Dickens. Some of Dickens's biographers have said that he possibly had a bladder problems or a bladder stone, but it's quite clear that Dickens's father probably had got gonorrhea when he was younger and then suffered with this urethral stricture. Dickens' mother, Elizabeth Dickens, she died when she was 73 of senility. Now, Dickens had 7 siblings. Fanny Dickens, we mentioned already, suffered with pulmonary TB. Alfred, Alan Dickens, when he was a young boy, suffered with water on the brain, which would suggest he had hydrocephalus. Letitia Mary Dickens, we don't know what she died of, but we do know, I've already mentioned that Harriet died of smallpox when she was 9. Fred Dickens had a burst abscess of his right lung. It's possible that he may have had tuberculosis. Alfred Lamert Dickens had consumption followed by terminal pleurisy. And then Augustus Newnham Dickens also suffered with consumption. Poor Catherine Dickens, now she gave birth to 10 children and had 2 miscarriages, and the last 3 deliveries were assisted by chloroform anesthesia. It's very likely that Catherine suffered with diabetes, and also it's very likely that she had pelvic organ prolapse, which would have caused incontinence and constipation, and she died at the age of 64 of cervical cancer. Now, it has been said that Dickens failed to get her admitted to a lunatic asylum. We know that in 1847, Dickens had a pamphlet given to him on the incubation of insanity, which was written by Dr. Forbes Winslow, who had 2 private lunatic asylums in Hammersmith. Dickens also knew 3 people involved with people treating people with mental illness: William Charles Hood, medical superintendent at the Bethlehem Hospital; John Connolly, physician at the Middlesex County Asylum at Hanwell; and also Thomas Harrington Tuke, who had managed the Manor House Asylum in Chiswick. Now, after Dickens and Catherine separated, Catherine moved to 70 Gloucester Terrace, and her next door neighbour at 69 was Edward Dutton Cook, and he wrote a letter to William Moy Thomas Cook and said he even tried to shut her up in a lunatic asylum, poor thing. Now, Sarah Wise, her book, Inconvenient People, Lunacy, Liberty and Mad Doctors in Victorian England, she mentions that descendants of Thomas Harrington Tuke have seen correspondence in which Dickens asked Tuke to investigate the possibility of having Catherine committed, but Tuke refused. Now, Dickens had 10 children who overall pleased him more as youngsters than they did as adults. He did so much to promote the advancement of his sons, especially through approaching people of influence to gain positions for them. Despite all his efforts, not all the boys lived up to his expectations. Charlie Dickens, we know that he died of heart disease, probably due to rheumatic fever as a child. He started work as in Barings Bank. This didn't really work out. He then tried the tea trade, went to Hong Kong, Shanghai, and Japan. And then he went into partnership on a paper making partnership, which failed. Dickens had to bail him out. And luckily, his sub-editor, Wills, retired. And so Charlie took over as sub-editor of All the Around and made a success of it. He also published Dickens's Dictionary of London. Mary or Mamie Dickens, she died of cirrhosis of the liver and ascites, which may have been due to alcohol. Together with Georgina Hogarth, they edited the first collection of his letters. And she also wrote a book of reminiscences about her father entitled My Father as I Recall Him. Katie Dickens, her death was, she died of exhaustion when she was 90. And she was born at Dickens's Museum in Doughty Street after a 12-hour labour. As a child, she suffered with tonsillar abscess or quinsy. She suffered with obsessive compulsive disorder. She also suffered with seasonal affective disorder, becoming depressed at the winter. And she was short-sighted. And she was a very accomplished artist and exhibited at the Royal Academy. Walter Savage Landor Dickens, he died of quite a horrible death, a ruptured aortic aneurysm. As a boy, he suffered with deafness, and then he joined the East India Company as a cadet. And at the age of 17, he became a lieutenant in the thinned ranks of the Queen's 47 Highlanders. Sadly, he fell into debt and his health broke down. Francis or Geoffrey or Frank Dickens died of a heart attack. During his childhood, he suffered with deafness. He also suffered with stammering and also sleepwalking. Initially, he worked in the Bengal Mounted Police for 7 years, then returned to this country, and then went to Canada and joined the Northwest Mounted Police. Alfred Dorsey Tennyson Dickens, he died of a heart attack. Now, he spent several years studying the import-export business in London. However, he enjoyed wearing fashionable clothing, and he ran up debts by using his father's name at various London tailors. Having failed in his choice of career, Alfred accepted his father's gift of an Australian sheep farm in June 1865. Sidney Smith Haldimand Dickens, his cause of death was bronchitis. He joined the Royal Navy as a cadet on the training ship HMS Britannia, later caught yellow fever, and he was promoted to sub-lieutenant. But sadly, he died on the SS Malta and was buried at sea. Sir Henry Fielding, or Harry Dickens, was the most successful of Dickens's son, and his cause of death was complications following a road traffic accident. He used to cross the embankment every day, and he used to raise his walking stick. But on this particular occasion, I think it was a motorcycle, didn't see him, hit him, and he died a few days later in hospital from his injuries. But he became a Common Sergeant of London, a sitting judge at the Old Bailey, and he was involved in the first edition of his father's letters. Dora, or Annie Dickens, her death certificate says teething 8 months. It's very likely that, in fact, the cause of death was more likely to be congestion on the brain due to encephalitis, and she's buried in Highgate Cemetery. Edward Bulwer Lytton, or Plawn, his name was, died following severe illness, so we don't know really what the cause of this was. But he emigrated to Australia, became a sheep breeder and grazier, and then he later entered politics, serving as a member of the New South Wales Parliament, and was a conditional purchase inspector of land. I now want to talk to you about Dickens's medical history. Dickens, like many people, wrote about his health, and he wrote many letters, certainly about his health, and they are contained in over 14,000 letters in the 12-volume Pilgrim edition. And here you can see the 12-volume Pilgrim edition in my library. I must admit, it was quite expensive purchase. I didn't tell my wife. I left them in the boot of the car, and about 2 o'clock in the morning, when she was fast asleep, I sneaked out to the car and brought them sneakily into my study. Now, Dickens, between 1832 and 1868, suffered with no fewer than 47 episodes of the common cold. What's particularly interesting is he describes them in no fewer than 20 different adjectives, using such words as intolerable, oppressive, hideous, villainous, dreadful, indescribable, and monstrous. So clearly he didn't really enjoy having the common cold. Now, this is a letter that he wrote to his future bride, Catherine Hogarth, in October 1835. My cold, I am sorry to say, is very bad indeed this morning, accompanied by a headache and all the unpleasantries which usually follow in its train. If it should be a damp night and the fog should continue, would you advise me to stay at home, take some gruel, try hot water for my feet, and go to bed early? Well, I'm sure that if I'd written a letter like this to my future bride, she would have told me to pull myself together. The treatments at this time would have been mustard poultices, foot baths, camphor liniment for the back, and barley water. Complications, of course, could occur, such as sinus infection, chest infection, asthma causing wheezing, and an ear infection, which would have been treated by chamomile or poppy head poultices. He also suffered with 2 episodes of influenza, and this particular drawing says, you may laugh, my boy, but it's no joke being funny with the influenza. He also suffered with trigeminal neuralgia, which is inflammation of the 5th cranial nerve of the face. Dickens referred to it as rheumatism of the face, or tic douloureux. He had 10 episodes. It affected one side of his face. He described it as insupportable torture and tearing myself to pieces. The only treatment available, of course, at this time would have been poultices and large doses of laudanum. He also had an obsessive approach to work. He used to do most of his writing in the morning, and after lunch he would go for long walks. He also had a ritualistic routine in his domestic life, and we would call this obsessive compulsive disorder. He used to rearrange the furniture in his children's room. When he was on holiday, he would rearrange the furniture and line all his brushes and books in a neat little line. In 1841, he had been suffering with an anal fistula, and so Frederick Salmon, the surgeon from St. Mark's Hospital, came to his house and cut out the anal fistula root and branch with no anaesthetic. So Dickens was certainly very, very brave, and he spent at least a week lying on the couch and dictating his letters to Catherine. He also suffered with overwork and stress. You can imagine that this was not surprising. He wrote the 15 novels, he edited 2 journals, Household Words all the year round. He went on demanding reading tours. He had a very demanding family, his parents, his siblings, and his children. So it's not surprising he suffered with overwork and stress. Now, what's interesting, if you compare the 2 images of Dickens, you've got on the left the lovely portrait by Margaret Gillies, which is in the Dickens Museum in 1843. And then just over 20 years later, you can see the dramatic change in his appearance. So this would suggest he was obviously overworking and stressed. Now, in 1859, we know that Dickens was separated from his wife, Catherine, and he wrote a letter to his GP, Frank Beard. My bachelor state has engendered a small malady on which I want to see you. And I believe this was a euphemism for gonorrhea. At this time, Dickens was living part of the time in Gad's Hill in Kent, but he was also living in a flat above the offices of All the Year Round. And here we can see the plaque, which would have been on the wall. And of course, in Wellington Street, that was near theatres and Covent Garden, where all the prostitutes used to hang out. But the giveaway is that when he wrote a letter to Wilkie Collins, he said the following: I want very much to come to Old Broadstairs for a day, but cannot see my way there yet. Perhaps a tumble in the sea might, but I suppose there is no nitrate of silver in the ocean. Well, it's a rather unusual thing to say there's no nitrate of silver in the ocean. Of course, silver nitrate solution was used to treat gonorrhea in the acute stages. And what they used to do, they used to introduce the solution into the urethra, because when people had gonorrhea, they used to say that passing urine was like passing shards of glass. And by passing the nitrate of silver solution into the urethra, it coated the urethral lining and reduced or eliminated the severe symptoms of passing the urine. In 1849, Dickens had a fall on his left side. He was cupped. You can see on the left, blood was taken by making an incision on the arm, and then an evacuated cup was placed over the incision. And then the next day, he was blistered, and this would fit in with the Galenic theory of balancing the 4 humours. He also suffered with headaches, which could have been due to tension, migraine, colds, or even sinusitis. He also used to take Cockle's anti-bilious pills, and these were used to treat bilious problems. Sometimes, of course, it could be used to treat headache, heartburn, or even indigestion. Now, Dickens suffered with recurrent dental problems throughout his life. His dentist was Samuel Cartwright Jr., who became the first professor of dental surgery at King's College London. In 1841, he talks about suffering with toothache. And then in 1856, he had to have one of his teeth extracted. But more worryingly, in 1867, before he went on his reading tour to America, one of his back teeth fell out. And this would suggest he had very severe gum disease. And as a result, he was fitted with 2 dental plates, one which he used for giving his readings, and the second one he used for when he was eating his meals. He also suffered with asthma. In 1844, he talks about wheezing incessantly. Later on, in 1856, he says, "All night I snort and wheeze." And then when he was on his reading tour in America, he talks about convulsive wheezes. He also suffered with insomnia. There was an occasion when he walked from Tavistock House, where the BMA is now situated, and all the way to Gad's Hill in Kent, 30 miles through the dead of night. Other medical problems: he suffered on 3 occasions with severe bleeding from hemorrhoids. He also had a carbuncle on his head, which had to be lanced. He cut his shin once when he was on his provincial reading tour. He suffered with constipation, which probably was due to taking too much of the laudanum. And he also suffered with depression when he was on holiday in Bonchurch, and also on his American tour in 1868. I believe he was a hypochondriac. The reason being he was constantly writing about his health, and the number of letters he wrote about himself would fit with being a hypochondriac. Now, he went on down to Chertsey for a hunt, and walked into the stables, and the horse, I think, thought he was going to steal his corn and bit Dickens on the arm. And as a result, Dickens suffered with a nervous seizure in the throat, which caused him to suffer with post-traumatic stress disorder, because he had recurrent thoughts about this particular episode later in life. The bite was treated with a poultice. He also had to take hydride Welch snuff, an extract of wormwood, to calm his nerves. On the 9th of June, 1865, Dickens was on his way back from France with his mistress, Ellen Ternan, and her mother, and he was involved in the Staplehurst derailment. He lost his voice for 2 weeks and became extremely nervous when travelling by train, and never fully recovered. And this would suggest of what we call today post-traumatic stress disorder. He also suffered with renal colic. What I mean by this is severe pain in the right kidney area. And the first episode he had was at Warren's blacking factory on the Hungerford stairs, and Bob Fagin made a temporary bed of straw for him to lie on, filled empty blacking bottles with hot water, and applied them to his left side. Altogether, he had 15 episodes of renal colic. He described his symptoms as rheumatism in the back, exquisite torture, spasm in my left side, and ecstasy of pain. Treatments would have been mixture with hydrocyanic acid, laudanum, which would have eased the pain. Now, henbane, interestingly enough, would have relaxed the ureter from the kidney to the bladder, where the stone would have been passing down. And then he also wore a broad, fat flannel belt. Now, on the left-hand side, you can see a magnified uric acid crystal. The middle the middle picture shows a X-ray showing the kidney stone passing down to the bladder. Of course, at this time, the X-rays weren't, in fact, discovered until 1895 by Röntgen. But also the right-hand side shows a person holding their left loin due to renal colic. Now, in 1865, it's very likely that Dickens suffered his first episode of gout. Gout usually affects the big toe, although it can affect any joint. And this is a lovely Gilray cartoon showing somebody suffering with gout. And this is quite an interesting picture showing the gentleman in the chair, showing his physician, his big toe, which is inflamed, and his wife looking a bit bemused. And always reminds me of looking a bit like one of the comedians. I can't think of his name at the moment. Les Dawson, I think it is. Anyway, in 1867, Dickens went to see Sir Henry Thompson, who was professor of surgery at University College Hospital, and he examined his foot. And I think Dickens managed to persuade him that he was suffering with an inflamed bunion. Then when Dickens was up in Scotland, he saw Professor James Syme, who was chair of clinical surgery at Edinburgh, and managed to persuade him that it was an affection of the delicate nerves and muscles originating in cold. We have to remember that Dickens used to walk long distances throughout the year through the snow, both certainly in the winter and also in the summer. Now, it's very interesting. Up until 1853, people used to talk about rheumatic gout, but Jean-Martin Charcot in 1853 was able to show that rheumatism and gout were two completely separate conditions. Now, gout is effectively elevated uric acid in the blood, and there are three stages. Stage 1, renal colic, which would fit with when Dickens first suffered with it in the blacking factory in the Hungerford Stairs. And then stage 2, it often affects the big toe, which would fit again with Dickens's first episode in 1865. And then stage 3, that you can develop tophi, or collection of uric acid crystals in the tissues. Now, the likely cause in Dickens's case, he enjoyed mutton chops. He certainly drank lots of port, and he enjoyed seafood. Now, what's interesting is all these are very high in purines, and when they're metabolized in the liver, raise the uric acid in the blood. And the treatments would have been laudanum to ease the pain, poppy poultices applied to the big toe, and wearing a special boot. Of course, anybody trod on your foot, it would be extremely painful. And then shortly before Dickens died, he ordered a voltaic band. And another interesting fact was when Dickens was on his reading tour of America for 5 months, the journalists put on a special dinner for him, but his gout was so bad, they spent an hour looking for a gout stocking because he couldn't get his boot on. Now, why was Dickens in denial about his gout? I think the reason was that two of his close friends, Wilkie Collins and John Forster, both suffered very, very badly with their gout. And I think Dickens didn't really want to suffer as badly as they did. Now, Dickens suffered his first transient ischemic attack or mini stroke in 1865 while he was on holiday in Paris. Then the following year, he saw Dr. William Brinton for an abnormal pulse. And I think this was very likely to be atrial fibrillation when the heart beats regularly. Although Dr. Brinton said that Dickens was suffering with degeneration of some functions of the heart and prescribed iron, quinine, and digitalis. He also suffered with arsenic poisoning when he was on his provincial reading tour in February 1867. And not only did Dickens suffer with arsenic poisoning, his reading tour manager, Dolby, and 4 of the bookkeepers as well. And what happened was that the hotel where they were staying at was being decorated. There was lots of dust, and of course the pigments in the wallpaper and the paint, the green paint, was contained arsenic, and the dust would have got onto the surfaces and ingested and inhaled by Dickens, his reading tour manager, and the bookkeepers. Then in 1867 to 68, Dickens went on his reading tour of America for 5 months. And here we can see all the places on the East Coast where Dickens visited from November the 19th, 1867 to April the 22nd, 1868. Now, Dickens's biographers all write about his American catarrh, which he suffered with for 5 months. Now, I was a bit puzzled by this, and I wondered whether or not this was correct. Now, what we have to remember is that Dickens was traveling for 5 months by train, giving these 76 readings. It was during the winter. The carriages which he was traveling in were poorly ventilated and were heated by stoves. And sometimes he was traveling from Boston to New York for 9 hours. And also when he did his readings, the reading set had gas illumination. Again, this would have been giving off carbon monoxide. And I believe that Dickens was suffering with chronic carbon monoxide poisoning, because in his letters, the numerous letters that he wrote from his trip in America, he describes headaches, flu-like symptoms, chronic fatigue, disturbed sleep, and even hair loss and thinning. And this would all fit in with chronic carbon monoxide poisoning. But what's absolutely fascinating is when Dickens went on his first trip to America in 1842, he wrote one of his letters, and this is what he said. From the constant use of hard anthracite coal in these beastly furnaces, a perfectly new class of diseases is springing up in the country. Their effect upon an Englishman is briefly told. He is always very sick and very faint, and has an intolerable headache morning, noon, and night. So it's interesting that Dickens obviously certainly seems to have forgotten about his observations when he went to America in 1842. And what's absolutely fascinating is when he returned to England on the SS Russia, obviously he was getting lots of fresh sea air on his return journey. He describes in one of his letters, his American catarrh cleared up after only 4 days at sea, and his appetite had returned, and he made a Gadshill breakfast that morning. And this would suggest that the carbon monoxide in his blood would have been flushed out by inhaling all the lovely fresh sea air. Now, Dickens went on his provincial reading tour in 1869, and on the 21st of April, he was in Blackpool, and he wrote to his sister-in-law, Georgina Hogarth, and described weakness on the left side of the body, which would suggest he had a minor stroke. The following day, on the 22nd of April, he collapsed at Preston. The tour was cancelled. He returned to London and consulted Sir Thomas Watson. Sir Thomas Watson examined Dickens and gave him a certificate saying that Charles Dickens was seriously unwell, suffering from great exhaustion and suffering with fatigue of body and mind. And he was not to resume his readings for several months to come. And the diagnosis was a mild stroke. Another interesting symptom that he described to Forster was, he said, when I was walking up Oxford Street, I was not able to read all the way more than the right-hand half of the names over the shops. And this is a neurological diagnosis which suggests that Dickens was suffering from homonymous hemianopia, so he had partial vision in both eyes. Anyway, Dickens seemed to have ignored the advice from his doctors. In 1870, between January and March, he went and performed 12 more London readings. He took his doctor, Dr. Frank Baird, with him, who checked his pulse, which went up from 72 to 112, which isn't a significant increase. I mean, if you imagine a young baby the pulse can go up to 240, and in the Oxford and Cambridge boat race, people sometimes have pulses that go up to about 180. So this wasn't a significant increase. Anyway, on the 8th of June, 1870, Dickens was working hard on The Mystery of Edwin Drood in his Swiss chalet. He came down for dinner and collapsed and went unconscious, and they called the doctor. The following day, they had to call in the top neurologist from University College Hospital, Sir John Russell Reynolds. He examined Dickens, he turned to the family and uttered these awful, frightening comments: "He cannot live." A few hours later, Dickens died on the 9th of June, 1870. And the diagnosis on the death certificate was apoplexy or stroke. And the likely cause of his stroke was due to a clot coming from the heart due to his atrial fibrillation. And what happens is that the clot would have gone straight to the brain and caused the stroke. Anyway, Dickens was eventually buried in Westminster Abbey in Poets' Corner. And here we can see the Dickens's gravestone. And next to it, of course, is the person who's buried next to him is Dr. Samuel Johnson. Thank you very much for listening to my talk. Thank you.
Thank you so much, Nicholas. That was honestly really fascinating. I think it's really what I always love about it. I loved it when I was reading your book and reading your presentation there. It just gives you a sense of how much everyday life could be dangerous. You know, arsenic poisoning from carbon monoxide, just traveling and living and kind of doing kind of normal day-to-day things was actually literally killing him. That's quite scary to think about it, isn't it?
Yes, yeah.
I was quite interested there. I mean, one thing that came up quite a lot in terms of the treatment was laudanum. And obviously laudanum, you know, famous Victorian treatment was, I think, is it opium and alcohol? Laudanum.
That's right, yes, yes.
What would be kind of the side effects if you're taking that sort of medicine? I imagine it'd be pretty high if you're taking opium and alcohol.
Well, I think if you take too much of it for a long period, you become addicted to it. And certainly Wilkie Collins was addicted to it, and he ended up going and taking morphine as well. But certainly, I mean, one of the more worrying things was a lot of the children's, mixtures contained opium as well. They called it, quietness. So if children were crying a lot at night, they would give them this mixture which contained laudanum as well. So it was even, even prescribed in mixtures for children as well. So, which is very worrying. I mean, obviously today that wouldn't happen.
It's from quite a young age, I guess.
Yeah.
Well, I mean, obviously, just to say as well, people do, to all of our viewers, do feel free to pop your questions in the chat box of the Q&A. We've got a couple that have come up already. Harry Cambridge is asking, did you read all of Charles Dickens's letters? How many are there, and how long did it take you?
Well, yes, the answer is yes, I did read all the letters. Took me about 2 years. There are 14,000 of them. That's the reason I wrote the book, really. When I started reading the letters, I realized there was a lot of medical information that hadn't been described in the literature. I mean, a lot of people had written about medicine in Dickens's novels, Pickwickian syndrome and these sort of things, but nobody had ever gone through all the letters and identified. I think it was about 23 different conditions that Dickens suffered from, so it was quite interesting to discover all these things, and that's the reason I wrote the book.
And it does give you such an incredible perspective. I mean, one thing that really struck me was when you're talking about Dickens's OCD and his obsessive compulsive, even rearranging the furniture, kind of having to be in control quite a lot.
Yes.
But of course, we know from Dickens's childhood, he had an incredibly unstable childhood, where he was moving from one address to another and presumably felt quite out of control, which is quite common, isn't it, for people who've gone through those experiences to develop things like OCD as they get older. So again, just gave you that, I guess, sense of the impact that his upbringing had on his physical health as he got older.
Yes, I think so. Yeah.
We've got someone asking, Mrs. Gamp, how would she relate to Charles Dickens' own medical history and experience? Mrs. Gamp, for those people that don't know, is a wonderful character. She's a nurse or midwife, and she's famously a bit of an alcoholic and enjoys the good life, as it were. Do you think that she was kind of taken from Dickens's experiences?
I'm sure he probably did come across, somebody similar to Mrs. Gamp, because she used to enjoy laying out or lying in with equal relish, I think, didn't she? But I think at this, certainly before Florence Nightingale, I think the standard of nursing was not very, very good, and certainly there were probably, a number of nurses who, drank alcohol and didn't treat their patients very well. I'm sure, I think a lot of these characters that Dickens describes in his novels were based on observations that he made through his life. I mean, he was able to, sort of see these people and then lock them in his mind and then put them into his novels.
And I always love, I suppose midwives in those days would also help lay out bodies, wouldn't they? And I think Mrs. Gamp, I think in the story sort of talks about having to lay out bodies, even the bodies of children. So you think actually even characters that are quite comic and they're there to be comic actually have quite that tragic backstory. You know that Mrs. Gamp is a bit of a boozer because actually she's having to do some pretty dire stuff. So there's a real richness there, isn't there? Somebody's asking, to have an anal fistula removed without any antiseptic. I have to say I cringed at that point as well. Was this before Lister's antiseptic doctrine?
Yes, it was. Yes, I mean it's quite remarkable that Dickens was able to endure this operation, because I mean normally, even today, people, have a general anaesthetic and then they sort of cut it out root and branch, and then they pack it afterwards. So the fact that he had it without an anaesthetic is quite remarkable, really. I mean, obviously, quite interesting that Catherine, as I mentioned, Catherine had her last 3 deliveries with anaesthetics. I mean, Dickens had, when he was up in Edinburgh, he found out about the use of anaesthetics, and that's why he decided that Catherine shouldn't suffer like she did with her previous 7 deliveries.
Lovely. Well, I think we are actually out of time, so I think we can't really ask any more questions. So please, if anyone's got any burning questions that we weren't able to answer, do feel free to message us in, and I'm sure we can get a response. Dr. Nicholas Cambridge, thank you so much for being with us tonight. That was utterly fascinating. I'm still cringing slightly, but I think that's a good thing, and I think it's good to get this very human perspective of Dickens, and I think how that impacted his work. I think it's such a unique and added layer to the research into Dickens's life, which I think is so rich and so interesting, I think, for everyone who's interested in Dickens's life and legacy. So thank you so much for making the time to be here with us tonight. Thank you to all of you at home as well. There will be a recording of this going out as well, so people can kind of catch up at a later date as well. But have a lovely evening. Thank you. And thank you for being here.
Yeah, thanks very much for inviting me.